to start the party. Uh, uh,
Hey,
hey, hey,
hey.
oh, oh, okay. Welcome to the Good Nurse Outlook podcast.
Welcome.
This here is my friend Ashley. She is a travel nurse. We're actually friends from Florida. This is season 2, episode 7.
Oh, okay,
Yeah,
big dog.
yeah. It's the consistency for me though. I'm
Yes.
working on the consistency. So much has happened. I'll catch y'all up on another episode because this episode is not about me. We were friends since like 2014, 15. We met on Twitter.
Those were the times. I'm telling you, Twitter back then.
I know. Got paid like tweet delete to delete all.
Really?
Yes.
I
You
didn't
know,
know that was a thing.
you seen my tweets.
Back then, Twitter was real like popping. 2013 up to like 2014.
Yeah.
I was like obsessed to the point where like I forget that I'm at work. It was
Yeah.
bad.
It was like live chat. Like,
Oh my gosh.
right?
And let us watch a whole movie together.
Yeah.
Everybody's tweeting.
Everybody's, yes.
It
yes.
was like a big watch party.
Yeah,
I mean,
those were the good days.
It was a time.
Friends from all over the world.
Yeah.
And we were just like locked in, sharing
They're
pictures.
still around. Twitter's still around, right?
I think it's called X now.
No.
It's Elon Musk did it. He bought Twitter and then called it X.
Oh, really?
But I don't be on it no more.
So it's like the whole layout is the same. Like if I were to log in right now.
No, I think even the app is different. It's like an X.
So
And it's
maybe
black.
they should be deleting all our old tweets. I hope.
No, they still there. Once I was like writing chart like a boss, and I'm like, okay, this gonna be out. I need to go delete my tweets.
Period. But I feel like you talked more about just uplifting women and being funny at the same time. You know, it was a vibe. It was a vibe. Everybody. See,
I was definitely uplifting women.
It was a nice vibe. I'm not gonna lie. I wish I be thinking like, damn, during that time, like we was enjoying ourselves. We was just enjoying ourselves for sure. We moved past
I
it.
am filled with the Holy Ghost. I do not even know that old nausea.
Listen. Yeah.
We all got a pass.
Okay.
But good times. So,
Yes.
Ashley, what kind of
Yes,
nurse
ma'am.
are you?
I am a registered nurse working. My specialty is in ICU.
Okay, Queen.
Yes.
I didn't even know that. I thought you were like on med surge.
Girl, I was on med surg for like 7 months. And what's funny was when I did my clinicals, I wanted to do ED. But the ED that I was doing my clinicals at, it was a lot slower pace, but still manageable.
Yeah.
Then I guess, I don't know what happened. I went to, I got accepted for a med surg position. And then 7 months later, I was like, all right, I gotta level up. I gotta go to the
Get
next.
out of here.
Yeah,
Get out of the trenches.
Right. I went to ICU and I've never been happy. I'm like, oh my gosh, even though it feels like you're taking care of 7 patients, it's still
How many do you have?
like back home. You know how back home a little, you know,
Back home is Florida. We
Yeah.
are from Florida.
Florida, and back home, in med surg, you used to get like 7, 8 patients max. Apparently, that's absurd from where I hear. So I'm used to it. But in ICU, I'll get max 3. But I feel like at least I know my patients. I know why they here up until how did they get to the point where they're at now.
Yeah.
Whereas when I was in med surg,
Just baby.
all I know was past meds. I got your name. At least I got the name in the
Yeah.
room right.
Yeah.
But just to read up on the patient and why they here, their history, their background, it was hard for me. It was really
On the
really
med
hard.
surge, right?
On a med surg.
Because you have like 7 to 8 patients.
But it's a smaller hospital, so I mean, like they don't. I
Are you
think
per diem there?
Yeah,
Okay.
I'm per
Yeah, you
diem.
gotta be. When
Yeah.
you are a travel nurse, you gotta be per diem somewhere. Just
you
in
do.
case.
You do. Like even my contract here in Jersey, it's gonna finish in a few weeks, so I have to go back home and work my per diem job. But
Yeah.
it's a lot different. And I'll be honest, like the smaller setting, coming to this hospital where I am now,
Is it
it's
bigger hospital?
big. Yeah, it's a bigger difference.
Oh yeah, you're right.
It's like it's a big culture shock that I'm not used to.
And then you see like different cultures.
Oh, yes.
In Florida, when I came to Jersey, I felt so embarrassed because like I never really seen like a real African. I never
Really?
in Florida. Where you seen a real African
It's
at?
mostly like Caribbeans.
Yeah,
Mostly Caribbeans.
Haitians. Jamaicans,
Yeah.
Cubans, Mexicans, Puerto
Yeah.
Ricans.
Yeah.
Not
You're
even many
right.
Dominicans.
You don't even see a lot of
You don't see no Indian.
no.
You don't see Filipino.
No. You know
You
what? Actually, there's a few
sometimes
Filipino
Philip,
nurses.
but not like
Like
up here.
no. Yeah.
And then what else we got up here? Like Egyptians. I never seen
Oh,
Egyptians
I had an
before.
Egyptian Uber driver, and I was like, "Oh,
You so exotic.
girl." I was like, "Okay, okay." I'm
Yeah.
so invested at where my Uber drivers were from. They're like, "Oh, I'm from Africa." I was like, "Oh my gosh, this is such like a melting pot
Yeah,
over
because
here."
down south, baby.
You get the same people,
Yeah.
and it's the same thing.
Yeah.
Yeah. So, and we're from like south,
South
not
Florida. Fort
south.
Lauderdale, Broward County, 954, Lauderdale.
Period. Throw the L's up.
Throw the L's up. You can take the girls out, out the hood, baby. Let me stop.
You know, we was in there.
Yeah,
We
yeah.
was in there.
We was in there.
We
Yeah,
was
that,
in there.
that country came out real quick. Sometimes when I'm talking, it be coming out, I'll be like, ooh.
Yes. Oh, look,
Baby.
it never left you. And you've been here how long?
14
10?
years?
14 years.
14, 15
Wow.
years.
Time passed.
Yeah.
Yes.
You started off as a
LPN.
yes. Shout out to the LPNs.
Yes. And you know what? I originally wanted to do RN, but I think I had some issues in schooling where, you know, it was taking me a little bit longer. So I ended up doing LPN, and I feel like, you know what? That's a smart route to do if you don't have the option to do the RN as of
Yeah.
yet. You know what I realized? Like I told her earlier, techs here get paid a whole lot more
Yeah.
than LPNs back home. When I did my PN, I failed the first. It was like pharmacology or something like that, and I still had like another chance to stay, and then I failed that again. So then it was like, all right, you have to come to the next entry class, the next class that's coming in for the LPN. So I did that. Girl, I didn't do so well either, but I ended up getting sick. So I had to take like a couple months off, and then I was like, all right, this is it. It took me like 2 years because I ended up getting sick. I failed the first time, and I was like, all right, this is it. And I was grateful that like the principal was able to let me come back, considering me
Yeah.
being sick and everything. And after a year, I got my LPN, and I was so excited. Like I was like, it took me a lot. The transition from regular school to LPN, you have to change your mind the way you think when
What do
you're
you mean
taking
regular school?
regular school. You
Like
know what I
high
mean?
school?
Just college, because when
Oh,
yeah,
you went to college?
yeah. Well, I started. I never finished. So then I was like, girls all over the place in my 20s. Like, I was like, I started. I didn't know if I wanted to do my BSN and then do my RN at the school that I was at. So I was like, I don't know what to do. So then I ended up doing the LPN. I failed that. I failed it twice. I came back. But what I was trying to say was that just to understand critical thinking
Yeah.
questions, just to
Yeah.
transition to that was
Yeah.
hard for me to grasp at first. And I was like, whoa, I thought it was going to be 1 + 1 is 2. Not 1 + 1 minus the 3. And it gives you 5. You know what I mean? Like, it's not, the answers is there, but you have to think critically to
Yeah,
get to
yeah,
that, you know?
yeah.
So my first test, I bombed it.
It
And
was
I was like,
it was like nursing question.
yeah, whatever level that I was at the time. It was like the first like critical thinking test that we took. It was like this is happening, what's going on? And I was like, oh snap. But I didn't study like
Yeah,
this.
yeah,
Hold
yeah.
on. I didn't think like that.
Oh yeah.
So that transition into that kind of held me back. But when I did my RN though, I it was pretty good. And that's why I say doing your LPN, it gives you that knowledge, that background where you do great as
Yeah.
an RN. You
Yeah.
do great.
In school.
In school, just become a regular as a nurse. You do great because you have that extra experience.
Yeah.
So some people look down on it, but listen, you got to do what you got to do to get to where you need to go.
Period.
That's it.
That part.
That's it. That's
Yeah.
it.
I always like if someone asks me, would you go like what do you suggest I do LPNR? And I'm always like, do what fits your lifestyle.
Yeah.
If you can't afford RN school, but you
Yeah.
could afford LPN school, do it.
Mhm.
Make the money to,
Right.
go back to RN school. A lot of times what people will do is they'll get comfortable with their LPN spot
Mm,
and then they'll never go back.
Yeah.
How did you stay encouraged? Because you fell twice.
mhm.
then you got sick,
Mhm.
and then you still had to go back and
Yeah.
do it all over again.
Yeah.
And I'm sure like you met people in your class, or did you not really like meet people too
I
much?
did.
Because it's hard when you meet people
And
and
then they excel. Yeah. That was tough. It was. It was really tough. It was like, oh Lord, like, but you know what? The type of people that I make sure I stay around people who are encouraging, motivating, and and there was just, you could do it, you
yeah,
got it, you know what I mean. And they were pretty really helpful. Like, if I had a test coming, and they would just kind of help me out in this sense because they had already taken the course. So I was like, help me out.
that's nice. I didn't
So
even think about
yeah,
that.
they already
That is
taken the
true.
course, so it's like they'll tell you, okay, focus on this, don't
Yeah,
focus on that, and stuff like that. So I try not to focus so much on the setback because I still reached to my ultimate goal. You know
yeah,
what I mean?
yeah.
It took me a while to get to where I was, but I'm happy nonetheless.
Were you like frustrated that you had to take like a state board exam twice? Like you got to take the LPN exam, then you got to take the RN exam.
Girl, my LPN, because I have such bad test anxiety, it took me 5 months to take it after I
I
graduated.
thought you was gonna say 5 tries,
No,
but listen, do what you got to do. Were you
five.
studying during the 5 months?
Yeah. But that's the thing. Like, I have so much test anxiety. I was like, no, I'm not ready. I'm not ready. I'm not ready. Girl, it took me 5 months.
And then,
When I took it, girl, was it that test? I
did
think
it feel easy?
I felt good, but it was one of those tests that shut off on me at like 70 questions. I was like, I did bad.
Yeah, yeah,
I
yeah.
failed.
Yeah.
I failed. But then, obviously whatever I was doing right because, it's either really, really bad
Yeah.
or really, really good.
Yeah.
So it stopped at me at 70 some questions. I was like, okay. And then even for my RN, I actually took it within like a few weeks. And
Period.
I
She
took
said, "I got this, baby."
yeah, I actually took it within maybe like almost a month, and I was like, no, I'm not gonna wait. I'm not gonna
Yeah,
wait
don't
around.
sit on it.
Yeah.
So, where was your first job when you became an LPN?
My first job.
The
So
setting.
the setting I did private duty, home
Oh,
health.
really?
Yeah, because during that time, for some reason, all the nursing homes that I applied for, they needed experience, and maybe I wasn't. Yeah, yeah, and I was like, well, how am I supposed to get my experience? I tried to apply for nursing homes. They wouldn't take me. And I was like, you know what? I'll stick with this home health job for a little bit. When I'm dealing with kids and, kids that are
That's
disabled.
so crazy
Yeah,
because my sister, when she got her RN and she passed, the only thing that she could get was like pediatric home care. They
really.
weren't hiring in the hospital. She's from Florida. They weren't. That's why I'm like seeing the pattern. Even like the pay rate.
Hmm.
The pay rate is low in Florida, and then it's like they're not really getting you in the hospitals. And
No.
then when you're in the hospital, that's still not a good pay rate, and it's
Yeah,
like a little bit more difficult and challenging.
it is. It is. And it's one of those things where you have to be like, you know what? I gotta take a pay cut or whatever to get to where like I did home health in LPN.
Hmm.
Then I said, no, I need something challenging. I need something to kind of
Yeah.
stimulate the mind. So I ended up driving to Miami to do a nursing home job. That was the only one that was within.
How far is Miami from where you live?
Girl, it took me about 45 minutes
Hmm.
to an hour
Yes, with the
with
traffic,
the traffic.
and you were working nights, or were
It
you
was it
days?
was either shift because I was like a PRN. So
Oh,
it's either 7 to 3, 3 to 11, or 11 to 7. I was like, listen, I need the experience. It needs to be on the resume
yeah,
whenever I get a job. So
yeah.
I was like, yeah, I gotta do what I gotta do. I learned, and you pushing that big cart.
Maybe that car's so big.
What? And I'm like, what? And you know what's funny? I was giving meds. You know how they say you gotta give meds at 4, gotta give meds at 5. And I'm sitting there, okay, I give you meds at 4, and then I come back, I give you meds at 5. I was like, I don't think that worked. I only got 8 hours.
I don't think that worked.
I don't think
You
that
know,
worked.
they could get meds an hour before or an hour after.
That's what I'm saying.
So baby, you about to
You worked
get
in nursing home, right?
yes.
So you know,
I
girl.
worked in nursing home as an RN. So when I was a CNA, crazy story. I got my RN on Thursday, but I was scheduled to work as a CNA on Saturday and Sunday. They told me they weren't gonna hire me as an RN, and they still wanted me to work as a CNA on the weekend because they were short. And I said, well, I called the board of nurse and I told them like this is what I'm dealing with, and it was a black lady. She was like, baby, because if something happens to you, whether you're a CNA or not, they're gonna hold you to that RN degree.
What made you call board of nursing? Like what?
Because I didn't feel comfortable with a registered nurse
Oh,
license,
okay.
doing patient care.
Mhm.
It was weird. I had saved, and I think it's very important to like kind of prepare yourself for like the job hunt experience,
Yeah.
especially like if you're a CNA and you're moving into an RN position. I didn't feel that confident that they were gonna hire me just because I've seen CNAs get their LPNs and they not hire them. So why would you hire
Mm,
me and
I
I'm getting
see.
an RN? So I told her like, hey, I called the board of nursing. This is what they said. So I guess I don't work here no more. And then I was like, I guess I don't work here no more.
Okay.
And I got a job close to my house.
What
30.
was it?
They
Another
were,
nursing home?
yeah, it was a
Okay.
nurse. It was a skilled facility actually.
Okay.
So they were actually doing more than the nursing home was doing. And
Mm.
it was 35 an hour, and I was like, oh, bet I'm a new grad. This is like really good, and I don't got no
Wow.
experience, and they was willing to train me. So I got a job there, and then I guess the nursing home that I was at, they wanted me to beg for a job. So they called me on Monday. Was like, well, we could give you $27. I was like, oh, I already got an offer for 35, but thank you. Then they started thinking like she already know the patient. They could only go to like $30 because their managers was making like 32, 33. You passing meds, doing
Yeah.
wound care, answering phones, calling doctors. You ain't got no secretary. You reading labs. You
Yep.
doing a lot.
Especially in 8 hours. It was 8 hours, right?
Yeah.
8 hours. And I think what was worse for me in a nursing home is when you get a new admission, there's like a packet of things you gotta do. You gotta call the doctors to reconcile the meds.
Yeah.
You gotta go through, and I was like, why?
Yeah.
Why is it so much?
Yeah.
As much as I love nursing home or skilled nursing facility, I can't go back.
Can't go back.
I can't.
How did you find the transition when you were in LPN school to RN school? How did you find that transition, like the schooling?
I found it to be a lot easier in terms of my studying habits, understanding the material a lot better. And it was an LPN to RN school, so it was about a year. So it was a little bit fast paced.
Right.
I understand it in a whole different concept compared to when I started LPN school. I
Yeah.
always say LPN was a lot harder for me than RN school.
People say that.
Yeah, because LPN, you when you first go into it, it's like you jumping right into it,
Yeah.
and you got to train your mind to
Yeah.
think that way.
A lot of people say that.
Yeah.
Just similar to like how people say like, oh, NP school is easier. Well, that it's not easier. It's just that
Mm.
you've already established that
Foundation.
girl, not my Jesus self. You firm foundation. Goodness gracious, locked in with the Holy Spirit. You love Jesus. Know your critical thinking. You know what to
Mhm.
expect. You're anticipating the needs ahead. So
Mhm.
that's like when you're already like, oh, okay, well, if this was going on, this is what I would be thinking about.
Right.
So in Florida, you work as the ICU nurse.
Yes.
Is there any specialty?
No, it's just a general ICU.
Yeah.
Like I said, back home, my hospital is really small, so like if a patient got to go to cardiac cath, we have to send them out, and then they come back, or sometimes they do the recovery over there. But it's pretty general. It's not
Yeah.
specific, not
Okay.
neuro
So
or
it's kind of
anything.
like all put together.
Yeah, yeah.
Yeah. So you're like, because they have like cardiac, surgical.
Here, this contract, I'm exposed to like neuro ICU,
Yeah.
cardiovascular
Yeah.
ICU, which they say cardiovascular nurses, CVICU nurses are kind of like, but I
I
don't.
was gonna say prestige.
They do. They've been okay. The providers, they could be a little bit standoffish, but CVICU nurses, they're okay. I mean, they're not maybe not as friendly, and I get it. The devices that they're dealing with and all that stuff, it's a lot. I'm in CV, I'm in neuro, I'm in general
But do
ICU.
you see that back home?
No, it's just one.
So
Well,
how do you know how to like? How do you adapt to it?
girl, when I tell you I had to adapt, I had to adapt. Before I got this contract, I had another local contract back home, and I was in neuro ICU. So I learned a little bit in there. It was a big change, and I think it was one of those things where, I look around to see how people are, I ask questions
Yeah.
or YouTube, hey, show me how you do this, and, or what do you normally do here and stuff like
Yeah.
that. It was a big change, and it
Yeah.
was a little bit nerve wracking too. I'll say that.
You always had to adapt to something.
Yeah, I basically adapted. I
Yeah.
basically adapted, and it was like, listen, do sink or swim, and I think I've been above water.
That's right. Yeah. Yeah, because even I find like for emergency room nursing,
Yeah.
like you go wherever, but
Mhm.
it's like ultimately the same.
Yeah.
There's no branches or bureaus or like
But
sections.
you guys that's tough though. I
Yeah.
don't know how you guys do it as an ER nurse.
We just do everything, and then we go somewhere else, and it's like you do everything.
Yeah.
Only thing I could say specific is like maybe like the trauma levels of certain
Yeah.
hospitals, or maybe what their ER is known for. Like I went to one that was like cardiac known, neuro known, gunshot wounds, like trauma
Mm.
level 1. So
How was that?
Girl,
Do you also get pediatric, or they had like their own pediatric
depends on
unit?
where you go. Some people separate, sometimes they don't.
Yeah,
I don't like maternity or
me
pediatrics,
too. Yeah,
so I try to stay away from it because I'm not a pediatric ER
right.
nurse. So I'll get a baby with a fever.
Mhm.
Usually it's like Tylenol or like
Mhm.
a cough syrup. It's
Yeah.
nothing like crazy that I get.
Yeah.
Yeah, no.
Oh, like I've seen ERs where they mix both
Yeah, yeah,
pediatrics and I'm like it's hard.
yeah.
You're dealing with adults and then you got a baby coming in. It's
And they
like,
parents, you got a parents.
oh, that's enough.
How was your time here as a travel nurse? I know a lot of times people say when you do specialties, it's very hard for people of color to be in specialties.
Mm.
Like I've seen that a lot of times where I've traveled. If I saw a person of color in ICU, it's usually because they were a traveler, but not because they were staff. Do you see
Mm.
that in your ICU?
The CVICU, for example, there's not a lot of black nurses.
Yeah.
I've probably seen maybe one, and I want to say
On night
she's,
shift?
yeah.
And that's where they had them at too, child.
Yes, and then I've actually seen two guys in a day shift, black nurses, but there's not so much. And I
Yeah,
was like,
yeah,
but the other ICUs, not so much either. It's
yeah, no.
mostly the others.
Even when I did a lot of travel contracts like ER,
Mm.
not too many color people. Like I
What?
usually be a lot of times, a lot like at least 3 contracts. I was literally like the only black girl there,
What?
and
What was
it's
that like?
awkward. It's weird.
Yeah.
People are weird,
Yeah.
and they try to make you feel comfortable, but it's not.
Yeah. Sometimes they talk to you in like a certain type of tone. I'm like, was that was that like
Yeah,
condescending or was that like, you know?
yeah,
But you know what I've noticed is like, you know what? I come to work. I don't. I'm not trying to make friends. I really just came here to take care of patients
yeah,
and do what I need to do.
yeah.
I want the environment to be
Right,
good,
right.
but like
Like we're
if you're
not
not
standoffish. We're not,
right,
but we don't. We don't.
right, right. In nursing, you need teamwork.
Yeah,
You need it,
and
and I
that's
just I don't like how sometimes they could be, and I'll be like,
when you're
okay,
on a travel contract. How do you know like they accept you or you feel accepted?
I don't know if they do. I think they just tolerate you. I guess
Big thing I noticed is just like
I don't
I'm
know.
usually around like Caucasian women a lot.
Okay,
Not like Hispanics, no.
nor Filipinos. I get a lot of Filipinos.
Not too much.
Mm.
Not that it matters. Not racist here, just saying. But like the thing I noticed is they'll be like, "Oh hey Naja, we're ordering Starbucks. You want some?"
Really?
Yes, girl. When they ask you if you want Starbucks, even if I don't want it, I be saying yes because then it's the issue. Like who she thinks she is.
Oh yeah, that's true.
Yeah.
That's true. I think so.
So how long you been a nurse?
I've been in RN. This year is coming up to 4 years.
Okay. You been an RN for 4 years?
Yeah,
How long you been an LPN?
4 years.
Really?
Mhm.
8 years?
Mhm. I became an LPN in 2015.
Really?
15, I think. Yeah. Why?
Why don't I feel like that?
Yeah. As an RN or as LPN?
No,
Or just
yeah, no.
I know you were a nurse
I was in
before
nursing
me.
school. No, that's what I thought.
Oh, okay. When you graduated, the following year I started nursing
You
school as a
started
year.
RN school?
Yeah. I was studying for my LPN.
We used to study at the gas station, y'all.
Yeah, gas station, not Starbucks,
Dunkin'.
Dunkin' Donuts.
Yeah.
Yeah. Girl, I can't believe we
We used to
studied at
be
a
late.
gas. Yeah.
Yeah.
We
But that
studied
gas station was lit though. Down south in Florida,
Yeah,
they
it
had
was
a
nice.
yogurt bar.
Oh yeah, that was it was a vibe. There was a book you gave me. I think I still have it. I don't even know what I
Is it a
did with.
nursing book?
Yeah, I think I still have it. I think I was studying for the test.
Ah, okay. So LPN 4 years,
Mm-hmm.
RN 4 years. What's next?
Uh, my friend had brought up about CRNA school, and it's funny because someone had brought it up in RN school, and I was like, I don't know if I want that. I don't. It sounds prestige. It
Yeah.
sounds like it's.
Ooh.
I don't think I could reach to that point.
Yeah.
But she brought it up to me, and I was like, well, why not? I'm in ICU because you need ICU
Yeah.
experience. I'm
Yeah.
like, well, why not? I could do it. Right now, I'm studying for my CCRN. I have to retake my AMP courses just
Yeah.
to kind of look good on my.
Really?
Yeah, because it's been over 10 years. Number one, when I was in college, like the transition from high school to college, girl, I was like bare
Yeah.
minimum was
Yeah.
all I
Yeah.
needed.
Yeah.
Yeah, so it was pretty bad. It was pretty bad. So I plan on retaking that and hopefully get into a CRNA school in 2026 and kind of step away from the bedside, look at it from a different
Yeah.
provider.
Yeah.
Like you, provider from a provider standpoint.
Yeah, we gonna talk about me on our next episode because the nerve. I don't even know. Like you guys, I got accepted for nurse practitioner job. No, I'm just a little nervous, but
I don't know why she's
I'm
nervous.
so nervous. I am so nervous.
I could see you in ED just handling your
And
stuff.
I be like, we need this. We need this. Push this. Hey doc, can I get an order for this? Can I? But
Yeah.
now I feel like, oh my gosh, I gotta make sure I order the right hypertensive medication. The
Yeah.
right drug class for the race. And I gotta make sure like, I'm looking at allergies, and I
Mm.
know there's apps and stuff like that. So I'm just really trying to like, be like, girl, just
But you'll be
God will
shadowing
carry you.
someone, right?
Yeah, I will be shadowing, but not a long shadow.
Okay.
What advice would you give someone that's debating between LPN or RN school?
Go with what it works for you during that time. If you find it harder to get into RN school, definitely do LPN. If you're able to get into RN school, definitely do that as well. It just depends on what is convenient for you at the time, whether financially or just the time being. Continue to keep going.
What advice would you give to a person of color who is trying to enter a specialty where they
Mm.
may not see people like them?
Be confident. Sometimes when I'm in those settings, I'm like, oh my gosh, I need to make sure I know what I'm doing and stuff like
Yeah.
that. More importantly, don't be afraid to ask help. Because
Yeah.
I feel like if you don't ask help, somebody's going to get hurt in that, and it could be the patient. And you don't want that to
Yeah,
be.
yeah.
So, don't be afraid to ask help. Stand your ground, because sometimes they talk to you in a certain way. You need to make sure you let them know, like, hey, tone that down. Relax.
Right, but
Yeah.
without being like the aggressive
Right.
black girl.
Aggressive black girl, right. It's true. It's true.
I asked this to all the girlies. When you were in nursing school, were you dating?
No.
Would you have found it hard to date?
I think so. It just depends. If you
Yeah,
have that
yeah.
supportive partner, I think they will understand.
That's a great response because a lot of times people will, oh no, 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 I couldn't handle. No, you can handle it if you got the right
Yeah.
person. You can handle
Yeah.
anything with the right person.
Yeah. You have to be someone that's really dedicated to your thing, because it's so easy to be distracted with your significant other that you're not focusing on school. So you have to keep it in mind, like, oh no, this is really important to me. Let me stick to this.
You have such a diverse background, right? You started from home care to nursing home to ICU to travel nurse. Do you feel like those things build up, and then LP and RN? So do you feel like all of that built up the confidence for you to start traveling?
The hospital that I came from was a lot
Oh
smaller
yeah, true, true, true.
in terms of resources, in terms of
Yeah, true.
having, this available, or just seeing new devices that you're not
That
usually
part.
familiar.
That's probably why I wouldn't be in the ICU.
Right.
Because
Just
there's
seeing.
always something new. Like,
Right. Right.
baby, let me stabilize you and then ship you off.
Okay. Listen, and there was a big thing between ICU and ED
Yeah,
nurses.
it still is. It's still there.
It's still a thing.
I still try to be respectful and everything, but
Yeah.
you know why? Because they be thinking that we down there twiddling our thumbs.
I do.
They
be
need to
thinking
come
that.
down to the ED and see
I
you.
do be thinking that.
You
though.
gotta see what patient. You got an aggressive patient. You got somebody dying, and you trying to.
I tell you, one time I had a patient came in with a high blood pressure, and I was like,
They
"That's
ain't getting
probably
no
why
meds.
they ain't get no meds." Like, that's probably why the patient came into the ED.
Yeah.
And the one thing y'all could have done, y'all have not done. And I was like, "Bro, this is." But I think one time I had a talk with you, and then you was like, we had to take care of like the acute things first, and then you ship them out because you need the bed to be available.
Yeah.
And then when I floated to ED, which is not the best experience for me, it's not. But
Just
I
saying.
see why you guys do what you have to do. As long as the patient's stable
Yeah,
enough
yeah.
to get to the, you know
Yeah.
what I mean?
And like I totally respect ICU nurses. In the EDs, sometimes if the ICU is full, we have to manage like 5, 6 drips. They probably intubated, so now you got propofol. You got all this stuff going on. Maybe you got another lady that got a miscarriage.
Do they
Maybe
give you 3 with an intubated patient and like 2 more?
if your patient, they'll wait until that patient is stabilized. But if all them drips is still running and that patient is stable, you clean the room, ain't nothing else to do. Maybe you get another patient. I think the most patients I ever had was at 11 patients.
At a time?
Yeah, one time.
What?
Yeah, you don't even know them. Can I see your band? Here your Zofran. Can I see your band? 2 milligram morphine. Can I see your band?
I can't imagine what report was
Rosef.
like.
We had our paper. We was reading. Can I see your band? Okay, this patient is here for nausea, vomiting, chest X-ray show this, pending ABTs. They all sitting in like, when you waiting at the bus stop and they all in chairs. So they all in chairs and you just, everybody, they close. Ain't no privacy. You literally telling everybody business. And they mad cool because they'll be like, bro, I got an STD. That's why I'm here. What? Yeah, I got some burning in my urine. Ashley, thank you so much for coming.
Thank you for
You see,
having
you were
me.
so nervous.
I was. I'm like, oh my gosh, I'm about to be in front of the camera. I don't know what I'm gonna do. Like, but you made it real
Hmm.
comfortable, real
Hmm.
comfortable. And
I
it's,
do what I can do.
you know, Naja's cool. Big ups to you. I know I've always told you, but I'm super proud of you. I'm
Oh,
one of those people, like me and Naja won't talk all the time, but like whenever something's going on,
baby, let me tell you.
I'm always, hey, oh my gosh, this is
Yeah,
amazing. I
true,
gotta stop.
true.
Like, I'm one of those people in the background, like, oh
Yeah.
my gosh, this is a girl. You are such an inspiration. And just seeing you talk, seeing you move, I'm like, bro, I've seen Naja transition from like to be where you
Ratchet.
are. Nah, man, everybody, everybody was ratchet. Everybody had a past, you know what I mean? But it's just the growth that we are. We different women.
Yeah.
It's like once we became professionals, everything else came
Yeah.
with it. You know what I mean?
Exactly.
We
Nah,
doing
that's
big
true.
things.
And I love that you take care of your family.
Yeah, yeah,
Yes, like you really
yeah.
be looking out. I love that we both do. We coming up,
Mhm.
we have certain things,
Absolutely.
but baby, we made it happen.
Yeah.
And we breaking
Generation.
generational curses,
Period.
baby.
Period.
Thanks so much for tuning in. Follow
Yes.
me on social media. Actually, you're not really on social media.
No, but I am original underscore her on Instagram. So follow.
Please follow her. Please get her on social media. I'll just randomly hit her up. Hey, you good? What you up to? I
Yeah.
ain't heard from you in a while. Where you? I'm in Africa. What?
Yeah.
Like
I
she the type to go on a vacation, not post nothing, not say nothing,
yeah.
not.
Yeah.
Only time she was consistent was during Twitter days.
Yeah, that's true. That's true. And then people were searching for me like, where are
Yeah,
you at? I
yeah,
was
it's
like,
true. It's
yeah.
true. Thanks so much for tuning in to the Good Nurse Alec podcast. Be sure to follow Ashley. You can follow me, Nurse.Naj, on TikTok and Instagram. You guys have a great day, amazing day. God bless you. I hope you learned something. Like, comment, subscribe. Tell a friend or tell a friend.
Yes, ma'am.
Peace.